Okay, good evening and welcome to everyone. Welcome to the Health and Wellbeing Board of the 25th of September. So we've got quite a few apologies, so I will just go through them now. So we have apologies from Councillor Mason, Simon Morritt from York Hunt Scarborough Teaching Hospital. We've got apologies from Sarah Story, Michael Melvin, Tim Thorber, who is substituted by Fiona Wiley, who isn't here, I don't think. No. We've got apologies from Peter Roderick, who is subbed by Jodie Farquharson. Thank you, Jodie. And Zoe Campbell. I think that is all.
Sorry, Zoe.
Oh, hello. Thank you, Brian. Yeah. So that is it for the subs. So the meetings of the minutes of the meeting held on the 24th of July. Has anyone got any comments they'd like to make on those? Nope. Okay, I shall sign them then. Sorry, should have said prior. Does anyone have any declarations of interest prior to this meeting? Nope. Okay, so we will move on to item 3, and that is public participation. We have one person registered to speak. So we move on from that to agenda item number 4, which is the children and young people's mental health. Thank you. Sarah, is it you starting? Thank you.
Thank you very much. And just personally, just a moment, just to acknowledge the desperate situation that we've just heard about with that young person. I didn't catch the age of that young person, but 19, thank you. I'd just like to start really with what's on my mind listening to that, which is that there's a paragraph in the report that you have in front of you, which is just front and centre of my mind when I hear that, and that is that in York we have 21% of our population are children and young people, but they are 100% of our future, and that young man has a future. How can we help that young man have a positive future? So that's what's on my mind when I hear that desperate situation, not only for that young person, but the people, their friends, their families, the people who are caring for them, who love them around them. So I was just taking a moment there to acknowledge that. Thank you. So without further ado, I'm going to invite a number of colleagues to the table, if they wouldn't mind. I think everyone knows me. I'm Sarah Coltman-Lovell, the Place Director for York, and I represent the ICB on this board. But today I have a number of colleagues with me. So Gail, Louise, Susan, if you'd like to join me just at the front there, and you'll also see that I've put the slide controls. I think they're in front of you, Gail, so you might have the power for this presentation. But just whilst we're letting my colleagues get themselves settled and put their nameplates in front of them, and I will ask them to introduce themselves in a few moments. I'd like to thank Councillor Bob Webb, first of all, for giving me the prompt a few months ago, and I never forget when I get a question that I can't fully answer. Which was, what is the ICB doing to support our children and young people? So I'm really pleased to introduce this item today, and my colleagues in the ICB, Susan, who works in our York Place team, Gail, who works in our children and young people's mental health team for the ICB, and Louise Wotton, who works in our York Place team as quality lead. And I will let you introduce yourselves far better than I've just done there. But they've done a fantastic report for us today, which is in your pack, really, really comprehensive in terms of outlining the work that we are doing. And that statement is worth just repeating, that whilst children are 22% of our population, they are 100% of our future, and that matters in so many ways. They're also 11% of NHS expenditure, 11%. So that's an important point to note as well. And children are 13 times more likely than adults to wait 1 year or more for access to community services. So there's some inequalities just baked into our system. This isn't locally, this is nationally, but I think it's really important today that we can have this conversation about children and young people in terms of mental health and their physical health. So thank you. Okay, next slide, please. Or first slide, please, should I say? See if it works.
Pointing it at the right bit.
I should say as well, while we're just bringing the slides up, so you've got the comprehensive report in the pack, which I hope you've all been able to read in advance of the session. What we're going to do today, because there's a lot of content in that report, is actually use a presentation to walk you through the really fantastic work that's going on. We've also got a video, which is always great to hear from our children and young people as well. But I'm just going to start with a few introductory slides just to set the tone, and then I'll hand over to my colleagues to introduce themselves and take us through some of the detail in their areas of portfolios that they lead on. So just starting with this one. So the Humber and North Yorkshire Integrated Care System has just refreshed its strategy. We did develop a strategy when the ICB was first launched, which had extensive engagement with many stakeholders across the system. And we just took a bit of time to refresh that earlier this year. And this is fairly hot off the press in terms of basically describing the strategy on a page. And I just want to sort of talk through a couple of areas on here. So first of all, our aim, if we're not here to reduce the gaps in healthy life expectancy, then why are we? That's why we exist as an organisation. That is our job ultimately, in terms of the £3.5 billion worth or so of healthcare resources. The job is to narrow the gap and increase healthy life expectancy by 5 years by 2035. We have a sort of an equal focus on our outcomes across the life course, which aligns very nicely with our York Health and Wellbeing strategy of start well, live well, age well and die well. I think what's really important just to pull out here as well is our partnership ambitions. So children are front and centre of the ICB strategy to radically improve the health and wellbeing of children and young people. There are 3 partnership ambitions, and that is one. That is the top one. Really significant. And as I said, it's because children are our future. We cannot hope to deliver an economically viable society without investing in our children and young people, let alone the physical and mental health consequences of not managing that well at the earliest possible point. So I think it's really important, and I'm really proud of the fact that the ICB has put children and young people front and centre. I think the other point just to pull out from here as well is the 4 big health outcome priorities, and why they are the 4 big health outcome priorities. They are reducing harm from cancer, cutting cardiovascular disease, living with frailty, all age frailty, and enabling mental health and resilience. And they are the 4 health outcome priorities because they are the contributors to widening health inequalities and that reducing health life expectancy. In some areas of our region, healthy life expectancy is actually reversing, it is not improving. So hopefully that's helpful, just to give a very sort of a brief overview of what the ICB strategy, sorry, the ICS strategy is. That's important because the S stands for system, which means it is co-owned by all partners, all organisations that make up our integrated care system, including local authorities. But I think really helpful to see that children and young people are front and centre. Next slide, please. So when you unpack that radically improving the health and wellbeing of children and young people, it comes down to our golden ambition. And that is what you can see on the slide before you, and what represents our plans to radically improve the health and wellbeing of children and young people. And this golden ambition was developed and is overseen by a Start Well board. So the Start Well board is represented, or rather York is represented through myself as place director, Martin Kelly as Director of Children's Services, and also the SRO for the Start Well board is Michelle Carrington, many of you whom you will know, who was the Director of Nursing with the Vale of York CCG and is my sub on this board as well. And many of you will know just how committed Michelle has been and continues to be to children and young people. So the Start Well board is feels, again, you know, not every ICB has one. They don't have to have one. That feels extremely important, and all of our sectors are represented as well. So we have the voluntary sector, the hospital sector, mental health sector, community health sector, and primary care, all represented. And Gail, I think you're a member of the Start Well board as well. So I'm in good company. And you can see that the golden ambition reflects all aspects of children and young people's care and what makes a thriving life for a child or young person in terms of health and well-being, emotional, mental health, oral health, physical health, but also safeguarding and special educational needs. And in the bottom right-hand corner, or a couple of things actually just to pull out here. So the health and care futures, what that refers to is, again, just how important it is to provide access for our children and young people to fantastic careers, but also within the health and care sector. We need you. But also the work that we're doing to target specific communities, particular children with specific needs, where just a little helping hand can make a huge difference. So the work we're doing around looked after children, for example, and care leavers, really, really fantastic to see. And Martin and I have been really keen to see an expanded offer for our care leavers in health. Next slide, please. And the last one from me, and then I will hand over for the team to talk through the really great detail, is just to make then the reference to the York plan. This will be familiar to you. This isn't my plan, it's the Children and Young People's Plan, which Martin has brought to the Health and Wellbeing Board previously, with really fantastic engagement from families and partners, children and young people, and building on from the joint strategic needs analysis. And our work in York reflects, I think, really well the ICS key objectives. That's no coincidence. It's because Martin in particular, and myself to a certain extent, but many others as well, have taken their time to really influence the development of the ICS strategy. And I think it's a good example of how actually when we all work together, we can make sure that the children and young people's voice, not only within York, but actually that these key priorities that we see before us are actually pushed forward into the regional sphere as well. So I think that was just worth a mention. So I'm going to stop there, and I'm going to invite my colleagues to take us through the fantastic work going on at the portfolio level for children and young people. Thank you.
So my name's Gail Teasdale. I'm the Children and Young People's Programme Lead working across the ICB. So I work across all 6 places. So I'll start off, and then Susan and Louise, my York colleagues, will go on. Before I talk about the work we're doing across the system on children's mental health, I did just want to put this slide up as a reminder that it isn't just about reaching the young people easiest to reach, I guess. So the Core 20+5 is a national piece of work being deployed at system level and locally, where we also think about what are the additional barriers there are for young people to access services. So that has a particular focus on the 20% most deprived wards in the country, but also our population health groups and inclusion health groups, and that can vary by place. I know some areas have a lot of high levels of deprivation, some less so, but that doesn't mean you don't have your own vulnerable groups. And it's about making sure in any of the work we do, we remove barriers that may be there for those communities, whether that's care leavers, it could be gypsy and traveller communities. So it is about making sure we understand our own populations at a system in place, and that any barriers can be removed. And then the 5 clinical areas underneath, which are kind of the areas we're going to cover in our talk. And they're the ones that were felt to be most appropriate and most important, and where there are barriers to young people accessing. Do you want to just introduce you when you get to you? Is that the easiest way? So we're going to start off. We didn't bring young people with us. It's quite hard to find one young person who represents everybody in York, and particularly everybody in Yorkshire and Humber. So they've made us a short film about the 4 priorities. So the Nothing About Us Without Us group, the film will tell you more about it, but it covers young people across all 6 places. And they've told us what matters to them around health and mental health. So I'm hoping the person who's far more techie than me will now work its magic.
Young people in the Humber and North Yorkshire area were given an opportunity to be involved in improving mental health services, and across our patch, that's what we've been doing for the past year. We've been coming together to talk about issues around mental health services and helping to influence the children and young people's mental health strategy. Because there should be nothing about us without us. My name is Amy and I'm a volunteer on the Humber and North Yorkshire Young People's Mental Health Advisory Group for Humber and North Yorkshire Health and Care Partnership. We're a group of young people who give advice to professionals and work with them to make positive changes to mental health services for children and young people, because over the years, professionals have realised how much the services that are being offered to us are in need of improvement. The meeting was really productive, and from it we agreed our top 4 priorities. Young people led awareness raising and training on the signs and symptoms of mental health problems and issues impacting young people's mental health, including LGBTQ+ and racism. Easier access to services. Young people leading on work and courses about children and young people's mental health to ensure their voices are heard, their lived experience is valued and are not shrugged off by professionals. Listen to us more. We created a consultation form and an online version to ask 3 questions. What works well? What doesn't work well? It would be better if. And here is what is happening now. More meetings are happening both online and face-to-face in each of our 3 areas, and we're learning how to deliver this consultation and planning our next events. There are so many ways for young people to have their voices heard and to help make a difference. I know what it's like to not feel like I have a voice and to not be listened to by services for my mental health. I've had my journey and now I want to help these services improve so children and young people can get the help they need. It's taken me 5 years to get where I am today, and if someone had said that I'd be a part of this group helping make services better, I wouldn't have believed them. We've already come a long way from when we started as an advisory group, and we're going to continue to help shape the services that are for us. And together we'll continue to make sure there is nothing about us without us.
So the reason Amy said 3 areas was North Yorkshire and York meet together, Holnish Riding meet together, and the South Bank meet together. And this is about genuine co-production and working with those young people. We've done loads of consultation. We keep asking the same questions. We've now got 50 recommendations. So it's how we work together for those solutions. And the reason I wanted to come, it was all going so well. The reason I wanted to come today is we are at a point where we are developing a new forward plan for children's mental health across all 6 places. So I'm not going to go through all of this data in detail. I've put it on so you have it there, but I think you all know the need for mental health support has increased massively over the last 10 years. So now about 19% of children need a mental health intervention. That may not be CAMHS, that could be mental health support teams, counselling, a whole range of things. But generally we're seeing that increased level of need, but also increased level of acuity, which does mean some children have to stay in services longer. Going back to the core 20+5, we know some vulnerable groups are more at risk. So LGBT young people are 34% more likely to need a mental health intervention. Looked after children and care leavers, 44%. Neurodivergent young people are more at risk. Also those excluded from school and who are NEET or have experienced trauma. Obviously, there's intersectionality within that. So if you're a young person who's been looked after and you end up living in a homeless hostel or supported housing, and you're LGBT, you are 89% likely. And children obviously don't come in boxes. So we have to think about all of those challenges. Based on the current projections, if we don't do anything, the numbers of young people needing an intervention will increase by 63% by 2030. Now, given that we don't currently have capacity to meet the need, that's why we need a more refreshed and forward plan so that we can really think about how do we do more particularly around early intervention. So the plan I'm putting together, and I guess for me, this is the start of a conversation with everybody on this board moving forward, because it needs to represent the needs of York, but also what can we do as a system and do it once and not do things 6 times, because we also have capacity issues there. So we will be working out, I say we because I'm not the person doing all this data analysis, looking at need, but then also what is the capacity in the current services we've got to meet that, and what is the gap? So doing that gap analysis, what works well, where do we need more of something, or where are there groups of young people or certain issues that we're just not able to address? We want to improve access, but also reduce wait times. We don't currently have data for City of York, but we will have in the next month. Due to the old boundaries, it's still flowing as Vale of York, so it's not an accurate picture of York. But by October, we will have accurate data for numbers of children accessing mental health support, but also wait times. What I will say is wait times, while access is going up, so wait times, and we need to bring those down and support people while they wait. We've got a new focus on outcomes, because it's not good enough to say X number of young people went in and X number came out. We need to know, did we make a difference and did we improve their mental health? We'll also be looking at finance. I know, Louise, you said 11% of the national spend goes on children. In terms of mental health, 7% of the entire mental health budget goes on children, which, going back to your thing about their 100% of the future, we need to make sure any money we do currently have is best spent and most effective on outcomes. But equally, we also need to have a clear list of gaps and priorities for the future, so that when money becomes available, linking back to what the young people want as well and their recommendations, we've got clear business cases ready to go, not kind of having to start from scratch on that. And looking at workforce, a large portion of our workforce will retire in the next 5 years. So we're doing a huge piece of work around how we get the next generation in to make sure we've got the staff we need for the future. So that's kind of the system-wide bit, and there's lots of stuff in the report that I'm not going to go through because you've all read it about what we're doing at the system level. And this work does include that transition from children to adults and how we improve that as well. So I will now hand over to Susie.
Lovely. Thank you, everybody. Thank you, everybody. My name is Susan Tvan. I'm Commissioning Manager for Children and Young People here at York. I work for the ICB. My areas cover mental health, autism, and some aspects of special educational needs and learning disabilities. Just picking up on that point about how much we spend on children, there was one figure that I had put to me recently because I needed to find out. The spend in the block contract with our colleagues at Tees-Esk and Wear Valley has since 2014 increased from 8% to 10% on children. So we have been successful in getting some additional money into the service, but as Gail rightly points out, and as I think you will see as a theme through this discussion, capacity is outweighing demand, but we have not stood still in looking at how we can lever further resources in, both into our specialist CAM service and elsewhere, but we are finding increasingly that capacity and demand are moving further apart. But what I've got for you on this slide is the I-Thrive model. And the I-Thrive model is, it's not a model of delivery, it's a model of thinking about how we move counterclockwise round that circle of help, because the aim is to see our children thriving. And in terms of their mental health, and in fact, this particular approach can be applied in almost any discipline, but here it's mental health. We're looking at how we ensure that children are thriving through how we meet their needs, and whether we meet their needs for mental health advice and support through getting advice, or whether we meet their needs in relation to what we would call risk support, which would involve maybe the crisis team or one of the specialist services. So the offer that's set out on the slide, and I'm apologising if it's not overly easy to read, I will run very quickly through the domains. In terms of getting advice, we're looking largely at self-directed help, and advice, but we're also looking at some of the important websites that are run, for example, through York Mind, through our colleagues at TUV, through national organisations such as BEAT, which is the National Eating Disorder Service. That's how you can get some advice. You can also get some advice from the School Wellbeing Service, which is funded into every school in the city. There are also some voluntary groups out and around that. Getting help, we see School Wellbeing Service, we see our Wellbeing in Mind service, we see the York Mind offer again coming in. They will do maybe direct work with the individual child, they will do work with the child and with the parent, they will be frequently working in schools, advising schools in how to support children better. Getting more help, this is where we would see our colleagues at TUV CAMS coming in. We would also see IAPT service for the 16+. We would certainly see the counselling service that's run by York Mind. These are more specialist services where you would expect there to be an identified threshold of need that was at play for access. And then finally, in yellow, not orange, we have getting risk support. Here we are moving into children and young people with very extreme levels of needs. For example, those who would require an inpatient admission because their mental health is very poor, or assistance from the crisis team or the first service, which works with children with very complex autism, who will also have mental health difficulties, and also services, and I think it was referenced in the very moving statement we had at the beginning of this meeting, into early intervention and psychosis services for those children and young people who need it. So that's a general outline of the offer in York. I have to say it's a little bit out of date. It's in the process of being updated as part of the refresh of the plan, because we've now got some additional support that's going in at high level through the Together We Can offer, through the work that's going to be done for care leavers, and for some additional funding that we're waiting approval on into some training and further advice into primary care and into schools. Okay. Next slide, please. I feel like Professor Whitty. And this one, I don't want to go through in great detail of this one. This is a statement of what we've been able to achieve in York. And I'm going to make a confession first off, that the York Mind offer is incredibly important within the city. It isn't, however, funded by health, but it's made its way onto this particular slide. But outside of that, we have a statement essentially of very important offer that is funded either through health or jointly, particularly with City of York Council, and some of these services are really key to providing a support that our children need to enable them to recover from illness and move to that state where they are able to thrive again. So looking at some of these in particular, we have a focus on a lot of this now with early intervention. This goes back to Future in Mind money that was made available in 2015. We made a conscious decision to not put Future in Mind money into specialist services. We made a conscious decision to put it into early intervention and into school. The School Wellbeing Service is now business as usual in York. It absolutely is. It's in every state school in the city. Is very well thought of. It's important because it's early identification, early intervention, and is diversion away from unnecessary and inappropriate referrals into the CAMS service, but works very closely alongside the CAMS service. We've now got a second Wellbeing in Mind team in York, which works into targeted schools. And the schools that we target in York are those associated with areas of higher deprivation. So we've gone for the secondary schools with their associated clusters of primary schools. It would be wonderful to get further offer and further extend the service when further funding becomes available from NHS England, because the service works very well. And again, it has a very close link into CAMS, It is a service that's offered by TUV, but it works absolutely at arm's length from TUV because it's seen as critical that it's able to work very flexibly and quickly with children. It's a unique service in the country because it has OTs, occupational therapists, embedded in it. And that's part of the realization that children do not work within their own selves. Children are part of a family, children are part of a school environment, children are part of the broader community within which they live. And the role of the OT is to weigh in advice, support, and work across schools and social care, as well as with the child in the school setting. Again, early intervention. I just want to add in, we've now got a reintegration worker to work with children who are unable to attend school because they are in distress. That is a service that is working very, very well. It was on short-term funding and is now being moved, I understand, onto permanent funding at City of York. If we look at vulnerable groups of children, you can see there that we have the opening of Together We Can, which is now a joint funded service between ourselves and City of York Council. And we found this year some additional funding into the Youth Justice Service for health support there across both speech and language, and refreshed funding for a CAMHS practitioner for the service. We've also got coming for care leavers, an emotional support offer that is being funded through inequalities money across the ICB into all 6 places, and there will be a worker for the York team. And then I just wanted to note under high needs, both the intensive home support team for eating disorders and now the day unit at Mill Lodge, which is an alternative to an inpatient admission. And we now have day beds, if you like, at Mill Lodge for 8 children and young people. And this means that they will receive inpatient levels of care and support, but they will remain living at home and are jointly held with some of the community team. And that's really important. Inpatient CAMHS units they work really hard, they're absolutely dedicated, but inpatient admissions are not a huge success for many, many children. Children will get better if they're able to be treated in their local community close to home. The Mill Lodge team do great work with their inpatient children, and now we've got the day unit. We will be able to treat children additionally, which keeps them at home, but we will also get step down from as well. And this is incredibly important for recovery for them. So we're really pleased about that. And those are just examples of how we've developed on and expanded the offer over the last 5 to 6 years across the city. Next slide, please. But this is against a highlight of challenges. And we'd start really at the top. Levels of need across all services are higher than the capacity to meet them. We used never to have a waiting list for children who needed advice and support from the School Wellbeing Service. They now cannot see all children next day in the way that they used to be able to, or within the next week the way they used to be able to. We know that our colleagues at CAMHS are receiving increasing numbers of referrals, and although not all of those referrals are appropriate for them, they are holding more children than they used to, because the acuity, that is the level of illness, if you like, is increasing and increasing significantly for children who are being referred into CAMHS. And there is a staffing issue. We have national staffing shortages. We have national staffing shortages across a range of mental health disciplines. And of course, if we haven't got all the staff we need in place because we can't recruit to them, then whilst we're thinking of other ways of managing the needs of our children, we are not going to be able to meet those needs as quickly as we wish to do so. So this is a significant point. But our focus has been for a number of years and remains very strongly, how we find more support and more funding for early intervention. If we stop children becoming ill, we prevent that illness, we prevent that developing acuity, we can help them thrive and thrive more quickly and for longer. And there's an interesting point. I mean, you'll have been hearing a lot in the news over the last couple of weeks following Lord Darcy's report about the NHS and the very difficult reading that report made. There was also published last month a report by the Institute for Public Policy Research, and that makes a similar point that overall, children's health is worsening both in its physical and mental health. This undermines school attendance. It disables their learning and disables their exam performance, and therefore has lifelong impact on them. So it's another report that is pointing out how critical it is that we can get health right for our children and young people. As the report has pointed out, as Sarah has said quite eloquently, children are 100% of our future. And we have got to ensure that if we can get it right for our children, we will get it right for our whole population, with massive impact on our economy and on the ability of our health service to function. And I think that was all I wanted to say.
Just like actually ask Louise Woodson, Senior Quality Lead for Children and Young People, and my rules all about quality improvement. Oh, sorry. Sorry.
So Louise Wootton, Senior Quality Lead for Children and Young People. My role is about quality improvement at York Place, working with our colleagues across the system, looking at clinical pathways and processes. I'm very cognizant of the time. So Chair and Sarah, I was going to present the things around children's improving physical health and well-being, but I'm wondering about, I'm happy to continue and present, but I'm wondering about cutting that short and leaving time for questions. But I'm also very cognizant that children's mental health and well-being dominates the children's health agenda often. And I don't want us to sort of forget that the physical health of children and young people is equally important. So I'll pop that to Sarah and to yourself as chair too.
We've got around 15 minutes left for this item. So I don't know, is it possible to have a brief?
Well, those that know me know I'm not very brief.
Oh,
yes,
yeah, your report and then some time for questions. Is that possible?
Yeah. Let's just, I'll run through very quickly, but somebody note it
you.
for going on too long, please. Okay, so again, ordinarily we'd have Karen McNicholas here, who leads the Children and Young People's Transformation Programme across the whole ICB. And I work relatively place-based in York. So Karen can't be with us. So I've said I'd present some of the work that the transformation programme is delivering across the whole ICB with some York-specific examples. So asthma is one of those long-term conditions with an NHSE focus, because 1 in 11 children have asthma. That's 2 or 3 children in each classroom. So that's a significant proportion. And you'll understand why I'm saying about the classroom later on. So it costs the NHS a significant amount of money in terms of attendance to A&E, and also we know that the outcomes for children in the UK are the worst in Europe. Next slide would be great, thank you. I've popped this slide on here just to show you that although asthma is equally distributed across the indices of multiple deprivation, those children who live in the most deprived areas have worse outcomes with asthma. They have more A&E attendances, more out-of-hour attendances, and have worse asthma control. Next slide, please. This is just a bit of an overview of what's going on in terms of health input into sort of improving outcomes for asthma in the children and people sphere. I'm not going to go through it all in terms of detail, but just to note that that's one aspect. There's many aspects improving outcomes for asthma, including sort of housing quality, air quality, as well as all the working with population health in relation to those. So asthma is one of the examples where in York, we have a specific service being set up. So what we're doing is we've got some money from the Health Inequalities Fund within York Place to put in post an asthma-friendly school post for 2 years that are for all children and young people's schools in York, to support children with asthma, to make sure that they can fully participate in the curriculum, but also fully participate in their social life. So we know that children, there are some children whose asthma is impacting upon their ability to attend school on a frequent basis. So this post will be to work alongside primary care and schools, putting in processes and pathways to make sure those children get this care in school that they need to enable them to attend school fully and participate fully. So asthma is at one example, but as you saw in the first core 20+5 slide, diabetes is another example where there is improvements across the whole ICB, and in particular York. We have a young person's transition team in place to support transition from childhood, adolescence and into young persons. There's work going on with the Healthy Child Service to deliver an integrated bowel and bladder workshop. So that's working alongside primary care, Healthy Child Service and our specialist bowel and bladder team to make the pathway and process much more seamless for families to be able to access care at the right time. There are a couple of sort of significant developments in terms of the therapies teams in York and Scarborough Hospital, where we are very aware of an increasing waiting list in terms of speech and language therapy and occupational therapy for children with sensory processing difficulties. So there's real specific pieces of work that have gone on that have been led, innovative work that have gone on led by the Trust, but had ICB input from myself and others around the ICB. And the other thing that's happening sort of locally is an NHSE programme that the York and Scarborough Trust are participating in to try and reduce the surgical waiting times, because we know that there has been an increase in surgical waiting times for children. So this had really positive, fruitful results where you can see there that 345 children were waiting for more than 52 weeks, but they've now got that down to 45 in the most recent sort of stock take. So it's a real significant improvement in those sort of elective surgical care waits as well. But the challenge is, you could cut and paste from the mental health slide onto this really, and I'm not going to go through this in detail, give you some time to ask some questions, but workforce, early intervention, funding that's appropriate to the need for children and young people, and identifying those children and young people who are at sort of increased risk in those plus groups, and having a focus on their improving their health and well-being. I think I'll leave it there. That was very quick, and I hope I got across the points that I needed to get across, but open up questions.
Thank you.
You're very
And
welcome.
sorry if that seemed a bit rushed, but I think it's really important to have in both the physical and mental health and move forward and seeing them as equally important to people. So would anybody like to start questions? Councillor Webb.
Thank you, Chair. Thanks, folks, for the single longest introduction to a report I've ever experienced. Yeah, and what I'd possibly say for the future is that that report was actually really useful, the visual report, but obviously that didn't make it into our pack and our agenda a week ago. And I think that, Sarah said that I'd asked for what are we actually doing for children, and that there's clear evidence of things that are happening and there's good work going on. And I'd hope that, we can have more of that in the future over time, because I think that's really, really valuable. I think I've got a couple of questions. I think one around the connection between children's services and adult services around mental health. If we think back to our public speaker who spoke earlier, and I don't want to focus on an individual case, but I do think it was mentioned on a slide by Susan, I believe, that last bullet point about that link between children's and adult services, and we're looking to strengthen those links. And I just wanted a bit more detail on what that looks like. And then my other question was going to be around other ICSs around the country. What are we doing to look to others to find good practice? because I think that there's clear evidence that whilst there's a lot going on, things are not going in the right direction. I'm not suggesting that that is sort of health's fault. That's very much a societal thing, I think. But actually, what are we doing and what's going on that's working well?
So in terms of transition, we have a working group across all 6 places because we're trying to look at it once, not 6 times. But also we are aware children live in one place and may go to school in another. So we're thinking about consistency of care, and in some places our care leavers may need to move to another because accommodation isn't as affordable in some places as it is in others. What we're looking at moving away from is age-led to needs-led, which is very much what the new national guidance is about and ties in with the Thrive model, so that it shouldn't come to that cliff edge of you are 18, now suddenly you've had, one young person described it as the next day I had some cake and suddenly all those services were gone and I had to wait for some new services. So we want to model it. There are other models of care, not mental health, but say young people's substance misuse, for example, where young people are able to stay in a service once they're already there until that need is met, not leave at a defined birthday point. Similarly, there's also the option for those young people, if they're almost 18, to just go straight into adults. What you don't then get is that cliff edge and that gap in between. And so we're looking at refreshing all of the policies and procedures around transition so that they're more based on that. And that feeds back to what young people have told us as well. We haven't got that offer right. Adult services are very different from children's. And the new national quality standards talk about also having that kind of key worker to guide you, because sometimes it's not just mental health, depending on the complexity of need, it may be social care as well. So having that one person who guides and stays with you as you get a bit older, so that services are more joined up. So that is something we're looking at as a system approach. In terms of the ICB and best practice from elsewhere, I meet regularly with my colleagues in West Yorkshire and South Yorkshire as our nearest ones. But also we have various forums where we do look nationally. Sometimes our ICB isn't recognised as good practice. The current stuff we're doing around trauma-informed care is one of 12 national vanguards, and we're leading the way on that. But there's also a lot we can learn from others. And I'll be quite honest, I'll plagiarise anybody's homework if it works, really. So we are very much, and I think one of the things that came up in Susan's was also we've got new and emerging issues. So things like ARFID is a different type of eating disorder, which is sensory. You can't treat it the way you treat anorexia. So we have to think about how our services respond to new emerging issues and meet those needs, which is partly why it's a good time now to refresh our plan and think about what works well, what delivers the outcomes, meets children and families' needs, but also where haven't we got it right? Because that will stop people then presenting very poorly if we can get in there early, and meet those needs. I don't know, did that answer your questions?
It's certainly a start.
Okay.
Yeah.
Well, that's why I want this to be a dialogue after this meeting. I'm not just coming to present a report. I want us, as the plan develops, I want partners here and wider partners in York. So what we should end up with is a clear plan of what matters for York, because you may have some particular needs that may be different to North Yorkshire. But then what can we do also as a system once, so that we have that plan for place and system. So it needs to be that dialogue with all the partners here and wider partners.
And I think with some disorders, Gail has mentioned ARFID, which isn't an eating disorder as we've worked with eating disorders for a long time. And we now need a point where we need a bigger response than York's response or Grimsby's response. And that also goes for some other areas of activity as well. I mean, sensory assessments, we hear an awful lot about. It's quite a complex area in terms of understanding how our children are functioning and how we can improve our children's functioning. But again, it's an area where doing it once, so that if I'm a child who lives in York but go to school in North Yorkshire, I'm not getting a completely different, offer, a completely different approach. So what we're trying to do is have some of these areas of activity come together more in a more coherent way. It's also a reflection of the fact that there is a shortage of suitably qualified staff in some of these areas, and developing the way we develop a service has to acknowledge that we can't have a big team in York and a big team in Hull and a big team in Scunthorpe, because there just aren't staff available to do it. So we have to look at how we work differently to make the best use of resources that skills and training that we can purchase.
Thank you. We'll move on now to Emma. Thank you.
Hi, thank you. Obviously, very welcome this report from you. A couple of observations, if I may, and then one or two short questions. I very much like the honesty of the report. I think you're starting explaining we are not starting from a shiny, glossy place, because we're not. And children's mental health and physical health, we have got a lot of challenges, and it falls on schools and general practice heavily. And I don't say I feel dispirited seeing a child about mental health. The reason I feel dispirited is that I've got so little to offer them. And I know that teachers, having met with them as we did, Susan, when we had our workshop, it's a similar feeling. One of the observations I'd like to share is, I think one of the impacts of COVID, virtual working, is the fragmentation that's caused in our system. So the other thing, it costs a lot more when each service works in silo and doesn't work collaboratively. And we are seeing so much more of that, each firefighting their own doors, their own boundaries, and children fall between these gaps. And we see it all the time. So I think there's something, we've lost the interactions between general practice and school nurses and health visitors. It's a massive gap. That means that continuity for knowing the child, know the family, know the community care offering around it. I think there's some real challenges we need to do to get this right. I guess with the aspirations, no one can argue with any of those. What I would like to ask is that there's some data behind it, and that we can see, because we put all that effort in, how do we know if this is working, we're putting the money in the right place? And Susan, just coming back to that, it's great to hear there's more funding and more funding going into TUVE. I guess when you look at some of the successful models, they're about community investment. And when we looked at we've been doing some integrated neighbourhood team working, and we looked at the East Cambridge model, which was really inspiring because it was all community focused. It involved social prescribing for children, because then you don't need the specialist. If you can get in there and help the child and the family at the early intervention point, you don't need to have 5,000 specialists, you need more generalists out there. So I guess the question is, can we do, sorry, it's going to be a theme for most of my questions, more in the community, because care close to home, working with schools, working with social prescribing, getting that care at an early intervention has real long-term impact.
And that's why we want through the plan to have a list of those priorities. So when I'm talking about priorities, I'm not just talking, no offence, Brian, about TUVE and CAMS, and I'm sure Brian would be relieved to know that it is about, have we got the model right for each place, and what would good look like? So we've got that ready, costed up. And so instead of me just saying, please sir, can I have some more every time money becomes available, I actually know what we want the money for, what difference it would make, and who to. And that's why the outcomes is, there's a lot of focus on numbers in and numbers out. We need to be better at saying, but what actually delivers that change? And I am coming to the LMC, by the way, so I'll probably get to see you.
Thank you. Is it a supplementary to that? Okay.
Yes, certainly. And just picking up on that, I think the work that we're doing very much in adult services around about that community hub, what does it look like? What are the range of interventions, both at an early stage before you even get near specialist services, is work that obviously is spoken as adults at the moment, but absolutely needs to be part of the children's work going forward.
And the step down, I would say, we're very good at escalating up. Young people have said in the consultation, they want what they call a soft landing. They want a more, you know, they might have a great CAM service, but they're nothing, and they need that more graduated drop down. So
Thank you. Thanks. Sian, did you?
And sorry, because I've got lots and lots of thoughts in my head, so this might not be the most coherent, but there was something for me while I was listening to it that just reminded me of all the stories we hear week in, week out from people who are trying to navigate this for their family members. And the challenge of navigating to those who will actually help them. And they say their life fundamentally changes when they find one person who cares enough to make a difference to them. So I think there's something for me about how we have more of those individuals within our system, and something about the values, the culture, the behaviours, that we're trying to open doors, not slam them in people's faces. I think there's a real issue for me around neurodiversity and gender identity. And I think we as a system, as a health and care system, are way behind that curve and need to catch up quickly. And I think we hear time and time again from children and young people themselves, but also from parents, family members trying to support them, that they're asked to carve themselves into pieces. Like, you can't be autistic and have gender identity issues, because that's not possible. You have to pick which thing you want help with. And it's like, you wouldn't ask a diabetic to put down their insulin dependency. You wouldn't ask someone to remove a fundamental part of who they are to try and help them. So I think we as a system need to get much more sophisticated in how we look at neurodiversity and gender identity. So I'd really hope that could be a priority. And maybe that is something we want to do across a wider place, but I think it's really important. I think there's also the challenge about how hard it is to get help, how hard it is for parents to say they need help in the first place, to put themselves in that vulnerable position of seeking support with something that for many people they take for granted. You have a kid, you parent it, job done, get to 18, send them off to university, everything's marvellous. For the parents whose journey isn't like that, saying, I can't do this by myself, and then being told, yeah, but you're in the wrong place, again, reinforces that sense of we are fighting a system that doesn't want to help us. So I think the words battle, the words fight are far too often heard in the context of there is a young person here who we should be doing something better for. So I'd really like to think about how we change that this shouldn't be an adversarial system that people fight to get what they need. And I also worry about the health inequalities impact of that the parents who are most able to advocate for their child will get the best results. And that actually reinforces health inequalities for those people who are least able to advocate for the people in their care. I think there's something for me as well about mental health and wellbeing support in primary schools, and that we are seeing greater acuity at such an early level now, and we are not equipped to deal with it. So it's great to see the increasing wellbeing in mind in secondary schools, but we need to get to a younger point with that very quickly. So I think, and there's also something as well about basic communication, basic administration, and the number of people who talk to us about them having to chase everything and never being told where they are in the system, who's going to help them, when they might get that help. They're just left in the dark, and therefore they are pursuing people. And again, it reinforces that sense of fighting for what you need. So I think even if you just can make sure that there's basic admin and communication built in, when people are on waiting lists, at least if they know they're on a waiting list, it's not ideal, but it's better than having no idea whether or not anyone's ever seen the paperwork that's been sent in. So I think there's so much about all of that stuff that we could put in place that actually doesn't cost the earth, but makes a fundamental difference to how it feels to be sat there thinking, I don't know what to do with this.
And actually, of the 50 recommendations young people made, probably 80% of them are about communication and things that don't cost money, just things that ways we could work in a better way. And that's why we wanted to have that ongoing dialogue with young people, rather than tell us what you think and then we'll go away and not speak to you again. And those young people working with services to do that, particularly because lives change. I discovered some young people don't know where you buy stamps. So, you know, but it sounds really simple, but if we're posting them things and saying buy a stamp, no wonder we're not getting stuff back. You know what I mean? We've got to make sure that we communicate in a way that's appropriate.
I would absolutely agree. And I think one of the interesting things for me from our conversations with young people through our core connectors work, which is going on across all of the Healthwatch, across the ICB, was we were asking, do you have an NHS dentist? And they said, how the hell would I know?
Yeah.
My mum and dad sort that out for me. And you go, oh yeah, of course. But we just assume everybody knows how this system of ours
and
works.
I think that's what we want from the future plan. It is about money and capacity and having the right staff. But it is also about how can we, within the means we've currently got, do things differently and more effectively. So,
and I think sometimes it's very easy for anybody working in a professional capacity to forget that they see 10, 20, 30, 50 people with this, whether it's diabetes or whatever, but the person in front of me only ever sees one person, and that's them. And I think mental health is a particularly isolating area to work in. and to be involved in. And Sean, you're absolutely right about the need for really good communications, because we can be giving important messages, and you've heard the word, I don't know, autism or depression, and that's all you've heard, and the rest of it is just going in a wave over the top. And I think there is a lot to be thinking about how we communicate and communicate again and communicate again. So that is absolutely right. I'm really pleased. As I said, school wellbeing service, just coming back to primary schools, you're absolutely right. And it is school wellbeing service who are finding that they're starting to experience some stress in terms of demand for them at the moment. They are in every primary school in the city. The Wellbeing in Mind team is in primary schools attached to the secondary school. So it's in a goodly number, but not in every single one. And their remit is to work at a whole school level, to work with staff and to work with children as well. And what we do have for them is both services. We have very high outcomes ratings for both services. We have very high satisfaction levels for both services across all domains of children, staff and parents. So we do have very, very strong feedback for both those. It's that, as Gail rightly points out, we do want people to return forms, and I think I would be hard pushed to find a 15-year-old who understood what a form was if it wasn't something on their phone. And there is undoubtedly some work to do there.
And they're the kind of things we can do at a system level, because we are developing an app with young people where they can not only feed their wishes and feelings into their care plan, but can give that outcomes in a way that works for young people, while also considering and not forgetting digital poverty. We need to find ways around that.
Thank you. So I've got Councillor Runciman, Alison and Martin. If we take those and then we'll move on.
Thank you, Chair. I want to go back to our speaker again, and also to Susan's report in particular. And it's about, my question is about information and advice. It's very clear to me that we're not getting information and advice out to people, which is part of the reason that our speaker got into the situation that she did. And I remember very well the Healthwatch report, which listed sources of information and advice. And it may be that Healthwatch needs to resurrect it again, because it was an absolutely excellent report. And people need to know where they can go when things go desperately wrong. And the time that they really need it, most of all, I think, is a transition between child mental health services and adult mental health services. And we've had that before with very sad consequences in our safeguarding work in adults. So I hope that Gail and Susan and Louise will pay some attention to making sure that that information doesn't just sit around this table, but sits in the public domain in places where people can find it when they need it, and find it quickly and easily.
Thank you. Thank you.
Would you like me to come back on that, Chair? Because I would agree absolutely with what Councillor Runciman is saying. And speaking of Healthwatch, I think the Healthwatch mental health guide that they produce is one I frequently borrow out the link for and send to people. And I have made sure that that's always in any other advice and information leaflet that goes around, because it's an absolutely excellent guide. But Councillor Runciman is right, it's reinforcing the point about communication and information. And sometimes the difficult point is communication and information when you're not in a system already and don't really know whether you're going to need to get into a system. And there are some questions there about how people find out things. And that's certainly something, again, the schools teams pick up very strongly on. But yes, absolutely an area.
And also why the VCS are really important, because certainly working with Chris Clays at Mind around podcasts and lots of ways of communicating with young people, perhaps before they struggle with their mental health, so that the information's already there, normalising that discussion about talking about mental health.
Yeah.
So it's those multiple routes, I think. So families and parents get the info, schools and universal services get it, but also that young people hear about it through routes that they would traditionally look at as well.
And self-generated as well. You know, this is young people generating their own material, and that's very valued.
Thank you. Alison. Thank you, Gail. That was a nice segue into my question. You knew I was coming. So just picking up on Emma's comment about how beneficial support from the local communities, and I'm talking about obviously the voluntary community sector. So you mentioned, Susan, that the Mind clearly play an important part in some of our services, but they're not funded through health. Do we know where they are funded through? And is that funding likely to continue? Or is it going to be subject to any cuts? Because, you know, we have seen cuts in the VCS and continue to see that. So, you know, it's an important part. And my other question is of part of the budget, which is quite low in its expenditure on children and people, how much of that is invested in the voluntary and community sector, recognising the contribution that we can make? And then picking up on the data question as well is, you know, how do we know that what some of the schemes are doing is making a difference so that we can start releasing money from where it is making the difference to scale up what you're doing? So is that work being carried out at the minute?
That's part of the forward plan in terms of, so I didn't get onto finance because I know everybody gets very nervous about money, but it is looking at where the money is as well. Is it long term? Is it short term? Because what we don't want to do is have a forward plan that says, oh, we've got this great service here, and then realise in a year's time we haven't got that. So it is looking at which services capacity, but also which ones are making the most difference. In a previous role, I did some cost avoidance work, and there were some VCS services where we could see 100 young people and they saved £500,000 after the cost of the service. So sometimes we have to think about, if we only have a small amount to invest, where can we get the most impact? Which also then takes pressure off their clinical services for those who really need it at that point, who can then be seen quicker. Because while I don't have York specific data today, which is a shame, I do know across the ICB there are 7,000 children waiting more than 12 weeks. I will have that broken down by York next month. And how is their mental health declining in the meantime? So even if we are seeing thousands, there's another 7,000 to be seen. And that's where early intervention could be quite key in terms of that. So I'm looking at that system, I'm looking at BCS, I'm looking at where is the funding coming from, where could it come from in the future, but also which is sort of ongoing funding and which is short term, and how do we stabilise that and invest in the right places moving forward. So that's part of what the forward plan will do.
Yeah, and the funding for Mind, do we know where that is? That from the council? Did I see it? Is that likely to continue, Martin? Not to put him on the spot or anything, but I think so. You don't need to answer that now, but it's important to take note that unintended consequences of cuts in one area could impact on another.
I think it's worth, if anyone's making cuts, it's the executives. So that's me and Councillor Steele Wellshaw. I think so. I'll answer that bit in the sense that, firstly, Mind is a national charity, and I think we need to be really clear that
local charity.
I'll just let me finish. So there are a number of national charities that need to look at every way that they can fund things. When a contract comes to its end, and then, you know, we need to look at that individually and think, right, do we want to refund that, or does it need to be funded in another way? As this contract in particular, I'll be honest, I've not looked at this particular one. I don't know when it's ending. It's not on my radar for anything, but I think what we've talked about today is really, really important. What Gail's just finished on there. If you put in that early intervention, which is what York Mind is doing, right, it has a real positive benefit. Currently, that is being funded by one part of this system, the council. Yet, if it works, all of those benefits are felt through not having to spend in health. And I think there's something to think about there. If we're going to do this and we're going to work in all sorts of areas, in all sorts of different charities, and funding for different charities, we need to think across the system and go, okay, well, how is it that we can support How can health support? And I say we as in the council. How can other organisations support? And how can we bring something together that works? Because we can agree that it clearly has a positive benefit. But we also have to be honest that, you know, the council's budget has to be balanced each year, unlike other partners necessarily. And that's something we must remember, that, that there's an issue. But yeah, I think I've skirted around that question enough now, but I think I've covered the basics.
I didn't mean to bang on about mine, it's just making that point of how important the sector is. And my other question, sorry, I know you're running over, was about workforce as well. So are we looking at workforce which isn't necessarily clinicians, but other types of people?
So we've mapped the clinical workforce, we've moved on to mental health support teams, the wellbeing in mind, and now we're moving on to mapping non-clinical, so VCS and other, because this forward plan has to be a system plan. It has to be about all of us, whether it's national, regional, local, because actually they're all interlinked and actually the funding is stronger together. And ultimately, when it comes down to it, young people don't really care who pays for it. They just want to know, where is it and will it help me? So what I want, that's why I've come here, because I want the plan to be all of us, not just one or the other.
Thank you, Martin.
Okay, before I go on to my question, or possibly not a question, I think I just want to sort of add value to that complexity of that conversation. Really, I think it is really important that actually mental health is a complex partnership. It isn't just about health, as we heard in terms of iThrive and every partner that needs to be involved around the table on this. I would absolutely encourage the voluntary sector to look for funding nationally in other ways that is absolutely charitable funding, you know, whether it's the big lottery or other funding, to bring other contributions, as well as looking at what's already in the system. I think that's incredibly important, and there's some national projects that are really interesting projects that I think we should look at. I did want to build on my original point was really going to be building on Emma's point, which I think it is exceptionally important that we continue to look at how we find different ways of using the funding that we have got to make sure that we spend the pound earlier rather than much later, which is we know is incredibly expensive. We'd all need to do that as partners, and then there are lots of conversations happening to try and achieve that. We know that we need to move increasingly more towards a social model of intervention rather than medical model of intervention. We spend a lot of money on diagnosis, and how do we spend that money better and ensure that the young people are receiving a service. I do want to say that actually York has been, I think York can be very proud in the fact that we've listened to young people, health colleagues, very senior health colleagues came around the table with young people who are looked after children care leavers, and identified the issue around the transition between 18 and 25 to 25 is even more complex for that particular group of young people. And what we have identified through health inequalities money across the ICB and across the region, which is a York-led bid, was around about £500,000 that will come into the system to trial a new approach, which is having a clinical psychologist central to the ICB, so across 6 areas, and then supporting 6 advanced clinical practitioner apprentices to look at different ways of working, look at how can we provide much more of a social model of interaction. I do think we'll be able to learn from that as a much bigger part of the system. What we can't keep doing is chasing more psychologists because they simply aren't there. We know we can't recruit nationally, so it's not just there aren't enough in York, there aren't enough nationally, and that isn't going to be the answer. So, you know, we need to, this is a really complex problem. I guess what you describe as a wicked issue. It's something that collectively, you know, we need to work and think of different innovative models that probably don't currently exist in terms of our new ways of working. But I think we've all got to try and get around the table and make sure that we maximise the money that we have got. I think the York Mind funding, I think we need to review it as the funding that we put overall into all services to see whether we could do things differently, whether that's local authority, whether that's health, public health, or charitable funding. That doesn't answer your question. It, a bit like Bob, it skirts around it, but But I do want to make the point of we've got to try and get to young people earlier. And we know that far too many young people are ending up in a system that requires a lengthy assessment and lengthy intervention.
Alison, did you want to come back really
Just
quickly?
very quickly, I just wanted to manage your expectations about getting funding from the voluntary sector from outside of York, from national trusts and so forth. We have hundreds of trusts closing their doors because of the competition, you know, the amount of applications they're getting. It is very, very difficult to bring funding in from national trust, from lottery. It's very competitive. So yes, we will try, but we need to be looking at investment from the system and a share of the investment that's going around for the sector, as well as trying to get it in. But it's very difficult. It's not like it used to be. It's you know, 1 in 6 success rate for trust applications, I think so.
Final word, I promise. Isn't austerity terrible? I think we can all agree that whether you're local authority, BCS, health, everybody, it's clearly had a huge impact and it's affecting all of us, isn't it? And fundamentally, it's affecting children and young people. And they've certainly had nothing to do to cause it, you know? Sorry, I'll finish there.
Thank you, Councillor Webb. I just want to finish that to say thank you to everyone who spoke. And it's really pleasing to see that children are at the front of the ICB plans. I fully agree with Councillor Runciman on the communication issue. Communication is like, I come across people time and time again who did not know that there were services available in their community. Years and years ago, there used to be a booklet. I mean, I don't think that service exists at all anymore, and there probably isn't, of every service available to young people in particular in the city. That was it. Thank you, Sian. And it was brilliant. And so many used to be given out, but communication is key when there are absolutely brilliant things happening and people aren't aware of them. And within that, we are striving to make the changes for young people. It's really challenging, and I'm not denying that it's challenging at all. And finally, I did just want to say huge thanks to the speaker, who your voice has been throughout this. I will continue discussing your story and looking for support and use it around awareness. And I just wanted to say thank you for speaking from the heart on something that must have been really, really difficult. Sian, did you want
Sorry,
to
a very quick point on signposting information and advice. Your Mind is a website that York Mind developed with children and young people. So it's been co-produced and there is huge amounts of information on there. So it's not the young person survival guide. You can't put it in your pocket, but you can have it on your phone in your pocket. So I know it doesn't change the digital exclusion issue, but there is a lot of information in there. And if we all know about it, we can share it with people.
Thank you. Okay. Sorry.
And if anyone wants to discuss the plan with me moving forward, I am genuine. I want it to be a dialogue. I don't just want to come here and come back in 6 months or something, because that's...
Sorry, Chair. Could I just ask that there is a senior officer around this table that meets with the public speaker? Just at least to, I think, listen to, and I'm not sure whether Brian. Thank you.
Absolutely, thank you. Okay, so we will move on to item number 5, the report of the York Health and Care Partnership. Thank you, Sarah.
Thank you, Chair. Right, well, let's see what we can do to make back some time. I'm going to do my report in 2 halves, if that's okay, Chair. What I'm going to suggest is that I pause at a certain point just to take questions on the first section and that before I move on to the second. And what I'll probably do is take all questions together, which might help just speed up and make back a little bit of time as well. So first of all, it's been another busy few months. Summer went by in the blink of an eye, and the partnership's been doing some really good work. And in the report, you have the minutes from the July meeting and also the agenda supplement, which is the minutes from the August meeting, which were approved last week, which is why they weren't published until last week. We had our usual regular meeting where we signed those off. So what I'm going to pull out is just a couple of key things from the previous meeting. So in July, we had our focused item, as we do regularly, on the progress of the Mental Health Hub. As you know now, the Mental Health Partnership reports through that forum, and we heard from operational colleagues about the progress being made with the 30 Clarence Street Hub, which is now up and running and is providing, as I said to Brian recently, a blueprint, trailblazing, I think I said, the way for integrated community-based offers, which broaden the definition of what we traditionally see as health and social care services, and demedicalising as much as we can mental health, which is absolutely what we should be doing. But also the joint work that we're seeing now that the service is up and running, following the pilot with the voluntary sector, the Tube Access team, adult social care and primary care. This is absolutely what we want to see in other areas of our communities, for families and for people living with frailty, for example, which we've talked about before. A number of actions coming through. This is why they're trailblazing. Wouldn't it be wonderful if we had a single care record for this team to be able to jointly record and provide care? That single-handedly would probably do more for integration than any pot of money could do. So let's see if the team can crack that one for us, and then the rest of the teams in York will follow. And again, the monthly conversation cafes, it was really great to hear about that. We don't listen enough. I think we know that. But again, the Lord Darcy's report, which I've touched on in this report, and Susan, my colleague, spoke about earlier, a national report which clearly highlights that the voice of people is just not heard enough. So the fact that we have the Conversation Cafe, which is a forum where we are continually listening to and redesigning and tweaking that mental health hub is really, really valuable. The fantastic news that we couldn't share previously at the Health and Wellbeing Board because it was embargoed, is that the next phase of the mental health hubs is now well and truly underway, moving forward to develop a open access 24-hour neighbourhood-based mental health centre. This news was embargoed due to the general election previously, so it's been the worst kept secret or best kept secret. I'm not quite sure. Depends on how many people knew about it. But it is now in the public domain. £2.4 million coming to York over 2 years to fund this model. Personalised care support on an overnight basis for those in significant distress. And I think the partnership really liked the fact that we held firm on not having beds, but actually moving to calm and comfortable spaces, because sleep is not necessarily the first thing on your mind in crisis. So really fantastic, actually, that NHS England supported that aspect of the bid, and I think shows that NHS England are willing to move away from a one-size-fits-all cookie-cutter approach, and really support us to deliver outcomes that are meaningful to people. So York is one of 6 pilot sites. I have no doubt that ours is going to be the best site. So watch this space on how that develops. I know the team are out to advert currently for the sort of centre team there. So really, really good progress. The partnership board will be keeping, or the place board, should I say, will be keeping a very, very close eye on the development, and also having an eye on how we build this as our model. This has got to be more than cherry on the cake. It's got to start to be the fundamental way we deliver services. So that's what I'll be looking out for, and that's what my place board colleagues will be supporting the team with. And talking of icing on cake, cherries on cake, we had our Connecting Our City event on the 17th of September. Was that this week or last week? This week. Last week, thank you. I forget which day it is. Tuesday last week, over 70 people attended. Really, really fantastic day. I had the pleasure of delivering a keynote speech at the end, which got far too emotional with. But that was because I met some truly inspiring individuals and some fantastic people delivering services with lived experience, working in the voluntary sector, supporting others, and it was truly inspiring, and really fantastic to see actually you know, voluntary sector services are not add-on services. They are delivering core offers to our population. So again, the previous conversation, I stayed quiet because I knew I'd say my piece now, but the importance of delivering voluntary sector services as part of core offers has got to be the way forward in York. So moving on from that, we talked also a lot around our development as a board, and that was sort of delivered in quite stark context, I suppose, in terms of the work that we need to do together to deliver for York. In terms of the again, we talked earlier about the pound, the importance of the health pound, working together with the local authority pound in this. Was kind of brought into sharp context really when we talked about the integrated care system financial plan, and the NHS is gobbling up resources at a fast rate, and it will keep on spending money as long as demand keeps rising. And we heard about the Humber and North Yorkshire financial position, which was £47 million in deficit year to date. And only 7 million away from what the end of the full year plan was meant to be in terms of expenditure. Now, lots of work has been done by particularly our hospital sector, but also our mental health sector, and to some extent in commissioning to pull that position back. But I think it does demonstrate the scale of the financial issues that are at play, which are very complex, but the savings that are required, and the need to maintain a control of that whilst also being able to support our transformation to flourish. And we heard about some of the amazing work going on earlier and the need for us to preserve that transformation work. We have a responsibility to our population, to our children, as we heard, and to, you know, to preserve that future. And we can only do that by making and taking responsible decisions together. So the development of the place joint committee, I'm speaking ahead now. We're not quite a joint committee yet, we are an executive committee, but we hope to be a joint committee in the future, taking real decisions with the resources on the table for York. So we talked a lot about that in the context of that financial position. So the final thing I'm going to say before we pause for questions is we also talked at the August meeting about the sort of shaping the future of the city. So now, as we start to get to grips with our role as a York Health and Care partnership, we are looking much more further ahead to the next 10 to 15 years. What is the work that we need to do to reshape health, care and prevention services, but also the estate as well, and the infrastructure, so the digital infrastructure that we talked about? Who else is going to do it if we don't? So we need to step into that space as leaders. And we had a really fantastic conversation that is really starting to sort of build that sense of shared purpose. So I'll give you a sort of a bit of a sense, and there's a number of paragraphs that do describe this, but starting to bring together our sort of integrated team. So there's a great quote in the Darcy report, which was the best way to work as a team is in a team. So we need to start to change the architecture around services so that they can work in a team, integrated teams. We've got some really great early examples with our family hubs developing. How can we build and mature and strengthen them to have that greater connection with all services? We've heard about mental health hubs. Our frailty hub is doing some fantastic work now, but starting to take that forward to become the real architecture of the city. So local, locality-based teams working with communities, with GPs at the heart, voluntary sector, community services, district nursing, health visitors, palliative care, older people services. How do we start to connect these? It shouldn't be rocket science, but sometimes it feels it is. But again, you know, starting to look at that over the next 10 to 15 years, looking at our estate. We've talked before about our GP services in residential dwellings, which is just not fit for modern general practice or integrated care. How do you deliver care when you need so many of those different community specialists that we heard about earlier to wrap around people, and for GPs when they are at that coalface, 90% of all contact in the NHS is through general practice. How do we support general practice to have that close contact with all of those other service providers, community mental health working as part of services, working with schools? That's the work of the York Health and Care Partnership, and that's what we started to talk about through our August meeting. So watch this space on that. I think we concluded that discussion by recognising that there is now some Humber and North Yorkshire led regional work called Design for the Future, which I'll come on to in a moment. But essentially the message was, in York, we feel that we have that clear sense of shared purpose to build, to shape a locally integrated primary community and social care model for our residents. So we feel ready to build that on behalf of York as our contribution to the wider Humber and North Yorkshire work. So I'll just pause briefly there, because there was another really important item that we discussed at our place board, which was led by and designed by the Humber and North Yorkshire ICB, which I'd like to talk about separately, if that's okay. So just pause there, and then I'll move on to that second half of the report.
Thank you, Sarah. Has anyone got any questions for Sarah? Councillor Runciman.
Sarah, I think I've brought this up before, but I am concerned about the accessibility of GP surgeries. And part of that is actually what you were saying about the condition of the estate. And obviously some of those surgeries are in very strange places and have been for a long time. But certainly the messages I'm getting from residents are that they can't get there. I won't go on about dentists, because I'm quite sure you know about accessibility or not of dentists, but the ordinary accessibility of people getting to the surgery or getting to the pharmacy does worry me. And I'd like you to just say what you're doing to have a look at that, to see if you can find some resolution to the problem.
Thank you. So we might pick this up as part of the Healthwatch item as well, because as I was reading that, there was clearly a strong theme there, exactly as you've said, about people struggling to get to services. So I think part of what we need to be doing over the next 10 to 15 years, we're not going to be able to build ourselves shiny new integrated care centres in every area of York either. But equally, there are many buildings that we have which we can't staff. They're not fit for purpose, and so on. With that comes a transport challenge. And I think that's only going to increase. What we need to be doing, and we do have in place, offers to ensure that people always have a choice in terms of being able to access NHS funded transport where there are changes to branch surgeries, for example. So those offers are in place for the population. But I suppose the reality is that providing services in every local community face to face with a local GP isn't always going to be possible or necessarily desirable as well, in terms of being able to staff those kinds of services over multiple areas. So it's a challenge that we recognise, and it'll be a case of having a sort of phase plan over the years, and we're just looking at starting as part of our wider work as a city a sort of a one public estate forum is probably the best way to describe it. So how do we make use of all of our public estate, not just the residential dwellings that GPs are delivering their services from, but lots of other buildings available to us? So can we look better at that in terms of making use of all of our sort of available estate for the benefit of general practice as well as other services?
Supplementary. Yeah.
Absolutely.
Long-term, Sarah, of course, we've got houses intended to be built all over the shop. And you don't need to answer, but I'm sure you will be looking at the long-term view, which says if houses are built there, where can they get to? And that all depends on things like bus routes for a lot of people. So I hope there's somebody looking at that spread and the geographical accessibility of surgeries when new housing estates are built.
So yes, absolutely. Just to reassure that in terms of any changes to buildings or housing growth, those are exactly the kinds of questions that we would be looking at. So areas of deprivation, areas of natural footfall, using the arterial routes, because sometimes travelling in is easier than travelling across the city. So all of those key considerations, but also engaging with our transport planners as well. So where there are major developments, there's obviously the potential to continually review those transport routes as well, to make sure that they are accessible to as many people as possible. Yeah.
Thank you.
Thank you. Alison.
It's looking in front of Sean, thanks. That's okay. she didn't mind.
Oh, so,
You didn't have your hand up? Oh, sorry, I thought you did. Oh, it was Bob. It was you, Bob. Yeah, sorry.
yeah, I've got him after Alison.
You do. Hard lines, mate. Just picking up on Sarah's point about the Connecting Our Cities event, and where we heard from 7 voluntary organisations about the work that they're contributing towards mental health support in the city. And that's as a result of the Connecting Our Cities recognising the challenge that we have in the voluntary sector of statutory partners sending people to us because they don't meet thresholds and because of waiting lists. And what this project has done is recognised investment needs to go with those referrals, and that's what has happened. So we've had 250,000 to invest in 7 organisations over 2 years, and we heard making a massive difference to waiting lists probably, and to supporting people that wouldn't normally get the help. That's good news.
That is really good news. Thank you, Alison. And yes, fully aware of people coming to voluntary services because they don't meet a threshold for the statutory ones and the pressure that that places upon the voluntary services. So that is really good news. Thank you. Councillor Webb?
I'm quite glad you went first then, actually, because yeah, I think you know, we've referred to the voluntary service essentially providing core offer, yet in reality not being paid core offer money, really, if we're dead honest about it. And I'm glad that that's starting to change. My question also links to transport, actually. And I share Councillor Runciman's concerns, I think, about everyone talks about new developments and there's a promise for a new primary school or a new health service or whatever it is in an area, and surprise, surprise, developers suddenly find a way not to build it. That's, again, not the fault of people around the table, but certainly something that we need to be thinking about long term. Specifically on the worst kept secret issue, we talked about a locality model for mental health, which would be a 24/7 service, I believe. So that's going to be in an area of the city, and you've just sort of said, Sarah, that there is an issue where it's easier to get into the centre than it is to get across. Am I right in saying this isn't going to be in the centre, and therefore is there an issue?
So I think it's not going to be in the city centre at the moment. It is part of a pilot scheme, so therefore it will, part of the sustainability of the pilot going forward is how we then create access for people across the city to a 24/7 offer that's demonstrated its effectiveness through that pilot. So it is very much focused on the neighbourhood, on that neighbourhood as part of this pilot for the 2-year period. But there is that commitment that actually sustainability into the future is really important. And if it demonstrates as an effective support for people in a time of need in relation to their mental health, then that will be part of the planning round about that model.
Thanks, because I can imagine if you are in crisis, which is a kind of time you're probably going to want to access this service, getting on 2 buses into city and then out at city, and it's not ideal. Whilst I totally welcome this, I think this is a really positive step. It's certainly a concern that I have, and if I've picked up on it, then I'm sure people who know what they're talking about picked up on it as well.
Yeah. So if I just come back on that, what it won't do is remove existing crisis services. So the existing crisis offer remains in place. This is additionality focused on neighbourhood as part of the pilot and the investment we've received, but to demonstrate a model that's effective and can then be looked at delivering across the city. And it may be that in the future that we would relocate that 24/7 hub to ensure that actually it's easier to access for the population.
Emma, is it a supplementary or a new? Yeah, just
following on. I guess actually my ask is probably of this health and wellbeing board. So Sarah, coming back, I could have mentioned primary care estates in Sian's item, or I'll mention it now as it's come up. I would actually seriously ask this board to get behind and support it, because if we're looking at the vision of what we're trying to achieve, which is integrated, non-fragmented health and social care, co-location is such an important factor. And there is not a single estate in York that is fit for purpose 22 primary care estates, goodness knows how many community mental health estates. We are fragmented. When we've got health and social care working together, ideally we'd have Healthwatch co-located, community mental health working alongside primary care, community resources together. Now that requires massive commitment because, Sarah, you know this, I've been working on an estates plan. You've got a health and wellbeing campus at Burnholme. We've got a plot of land waiting for a health centre. And it was NHS England wouldn't give us the money. Then, oh no, the ICS couldn't, well, sorry, CCG couldn't get the money. Then it was, no, the council need a pot of money for, it is barrier. And I guess if we want to make this happen and we genuinely collectively believe in that vision, that co-located community resources, whoever owns them, I have no conflict of interest with that, is the way to deliver a sustainable primary care. Because looking at the visions, you can only look at Scandinavia, other areas, this is where it works well. So either we get behind it, in which case we'll then solve the issue about bus routes and travel. But we have got crazy situations where in Acomb, within under a mile, we have 6 different GP health centres, community mental and plus other services. They could be co-located in one fantastic resource. So I guess there's an app. Does the Health and Wellbeing Board want to have that vision of integrated health and social care? In which case we need to look at estates because it requires all of us to work collectively together. It is a more efficient way in the long term, but it will require investment in the beginning. And that is the blocker to this time after time. And I guess I just hope that in my time working in healthcare, we might get one of those hubs happening. Sarah, good luck.
Thank you. No, and I think we we absolutely do have the vision of integrated health and social care and see the benefits of having everything in one place where people need to access is the absolute, yeah, it makes absolute sense. Yes, yes, Sarah. Yes. Please, thank you.
Thank you. So really helpful to get the board's reflections on sort of the work that we're trying to do, but you know, just to reassure you really, the level of ambition and the sense of purpose I think that the place board has had in terms of in the sort of progress it's made is really palpable, and I think that's just come through in some of the comments that we've had from members as well. So thank you. So the second half of my report, we so again this was also at the same meeting actually. So it was lots about the long term and how we need to change. We also received a report from the Humber and North Yorkshire ICB, which is it was a sort of a proposition really for how services signalling may need to reform moving forward to be able to be fit for purpose. And I just want to talk through some of the items, and certainly we've touched on some of these themes today, but they are really, we've talked about issues for a long time, and it feels like we are on the precipice of something very, very different in terms of the challenges that we're facing. And you'll be aware that the new Labour government commissioned Lord Darcy to write a report about the state of the NHS, and I think I shared the link, possibly not the link, but the reference is in the paper, so you can certainly Google it and read it. I would encourage you to do so. But this is something that we discussed at length at our August meeting. It's really important that the board, I think, discusses it. There are no recommendations, but I do propose that we have a brief discussion about it. So the issues, 75% more people aged 75 or over by 2043 is 7 hospital wards just for York residents. Just for the population of York, 7 more hospital wards. And York Hospital is having to close wards because we can't staff them. That's the issue that we were facing 2 years ago. And that is only going to continue. So 7 hospital wards is simply not possible. Aside from the fact that the hospital is landlocked in terms of the hospital infrastructure, the road infrastructure, there's nowhere to put 7 new hospital wards. So that in itself means we need reform. But the other really significant issue that many of our specialists and most experienced staff are retiring, and we're seeing it in every sector. We're seeing it in our general practice sector. We're seeing it in speech and language therapy, for example, which is significantly impacted on children's waiting times, and many, many, many other areas, in every single area. In fact, I would say. So we simply cannot deliver services the way that they are. We don't have enough specialists to deliver treatment-based services. We've got to move more to that early intervention model. But you can't fix the plane whilst you're still flying it, or something like that. so something has got to give, and we have to change the way that services are fundamentally delivered, because what we also hear is that there is no more money. So the only answer is reform. Another quote from Darcy was that the system is currently designed precisely to get the results it gets. You know, so again, if we want different results, and let's remember, how long has the NHS been failing the NHS Constitution standards? And the NHS Constitution standards actually hide they focus on acute care, but actually there's a whole other raft of standards in general practice and mental health and community which can be hidden, which we're really struggling with, and we've got to restore some public confidence in our services. So the Humber and North Yorkshire has got a jump on this, I think, by discussing this in August, and recognising earlier than Lord Darcy's report the need for significant change. So health services are starting to respond. We are already doing lots and lots of things to be able to improve services, but it is nowhere near enough for the reasons I've just set out. So the ICB is looking at three main areas of focus. And the first one we've talked about in the previous item, and I've made it really clear that York Place is committed to being able to deliver and drive a different model for local, integrated primary, community and social care, delivered in neighbourhoods. We know that works. There's plenty of international evidence that working in sort of meaningful communities and clusters of communities that are meaningful to residents works really well. And through that model, what we would be aiming to do is deliver well over 90% of contact with the sort of health and social care services locally, enabling people to access primary, community, mental health, long-term condition support, including outpatients as well, and end-of-life care, including demedicalised mental health care services as well, which is we've talked about before as a board, is so important. So that's the first cog in that. The second being mental health, learning disability and autism services. We don't have sufficient services. We have a number of services across our region, but many people are having to go out of our area, out of our region, many miles away, at a great cost, not only to the person, but to the system as well, in terms of those individual costs. We could do that far more effectively through a single regional model, and that might mean potentially from a single location for those specialist mental health and learning disability and autism services. And then the third cog being acute and specialist services, so hospital-based sort of physical health services, but also the specialist services as well, such as renal dialysis and other of those services being delivered on sort of on an axis of sort of the Hull and the York axis across the region. Generally, people are accessing these services much more infrequently than the other services. So what we want to be able to move to is where people are accessing services sort of at a high frequency, they are all delivered locally. But for services of an episodic nature, where you might be going in for a particular bit of surgery or treatment with a short length of stay, 5 or 6 days perhaps, that actually is better delivered in a single centre of excellence. Again, we spoke earlier, we do not have the specialists. Think of all the specialists, in a hospital services. There are 20, 30, 40 different specialisms delivered in a single hospital. All of them, every single one of them, without exception, has national shortages. There are simply not the recruits coming through the training systems to be able to replace the people who are retiring. And it was accelerated through COVID. So the number of people who chose to retire accelerated, and we're in a really perfect storm around our acute services. So again, that's the third cog that's been looked at. So really important, the role of place in all of this. The ICB wants to hear everybody's views, including the public, including stakeholders and staff as well, in thinking through any proposals. So I just wanted to share really a really kind of honest description of the conversation that we had at our place board, and the real sort of commitment from our place committee, particularly to lead on that work around local integrated services, which I think we're well placed to do, but important just to share those other areas of change as well, potentially with mental health and acute services.
Thank you, Sarah. And moves on really well from what Emma was saying about these integrated services based in communities for where people need them and what people need them for. Did anybody else want to make any comment? No? Okay, no worries. So, shall we move on? I know there's some people possibly do have to leave at 6:30 and that is absolutely fine, but let's move on because it is really important to Sian's Healthwatch report around GP services in York. Thank you, Sian.
Thank you, Chair. I realise I've got 2 minutes, which I've never done anything in my life in less than 2 minutes. So we'll see how we go. But our job within the health and care system is to give voice to people's experiences of health and social care. We're here to make sure that the health and care system understands what matters to people, particularly those who are least well served by our existing support services. But we also live alongside the system. We work with colleagues who are feeling the pressures of working within it, the tide of unmet need that faces them daily. And part of our role is about encouraging honest, open conversations about the challenges we face as people, as a system, and how people can help shape our solutions to these challenges. We received over 1,300 responses to our survey around access to primary care, which is the most we've ever had for any of our work. I think this reflects the strength of feeling, the willingness to share opinions about access to GP services. Though I must also thank our amazing volunteers and local GP colleagues for helping spread the word about the survey and encouraging people to respond. And I think that was really pivotal in making sure that more people heard about this and were able to give their feedback. I also want to thank everyone who completed our survey. As you can see, the bulk of our report is direct quotes from people who did this, exactly that thing. There were many positive comments sharing what people value from their local GP. Indeed, nearly a third of respondents rated their GP practice as 8 or more out of 10. But there's also much food for thought within the report, with concerns about access, continuity of care, communication, quality of care, equality and inclusivity, staff attitudes and behaviours, how we respond to mental health issues, and what it means for those who find it hardest to access help when services are no longer offered on their doorstep. Recently, when discussing GP access for those with long-term conditions with a range of people, including volunteers and members of the public, I was advised and reminded that we cannot emphasise enough the importance of continuity of care for individuals. People want a GP that they usually see, particularly where they have a long-term health condition. They want someone they know and trust, who understands simultaneously that knowing their condition is important for every health matter they have, but also doesn't put down every matter of health they have to that condition. As one respondent put it, when you don't have that, you don't feel known. Visiting a GP often holds an element of fear, which I don't think we should forget. Do I have cancer? Am I having a breakdown? Could this be dementia? Or simply, what the hell is wrong with me? The doctor-patient relationship in such circumstances works best based on mutual respect and trust, which even our most highly skilled practitioners would be challenged to build within a 10-minute appointment. I don't think anyone would deny that. This is a really challenging time for general practice and our health and care system more widely. We've heard throughout the presentations today that capacity and demand are not in sync. They are a very long way from that. But there are also opportunities for us to explore, considering integrated care, community hubs, the changing roles for pharmacies and independent prescribing, the opportunities of better access to voluntary and community services that divert people from needing health and care services at all, early intervention and prevention. I hope you agree that there is much within this report, our urgent care report and our pharmacy report, that when you keep in mind collectively, helps us think about how these ideas might take shape. I would draw your attention. We haven't made formal recommendations, but we have proposed some next steps. Those are on page 42. I'd really welcome agreement from the board about the best routes for us to take forward those next steps. I think Councillor Runciman will be pleased to know we are suggesting some more work for ourselves, bringing together a group of volunteers, hopefully working with other VCSE partner organisations to review access at GP surgeries, both online through websites and face-to-face. What does it feel like when you walk in? Is it easy to navigate? Are particular challenges that people might have in accessing taken on board? how easy is it to get in there. But there are some other next steps in there that we would propose to work with colleagues on. So I would really welcome that, and I'm happy to take any questions. And we're only a little bit over time.
Thank you, Sharon.
I'm going to go. Susan Kerr, it's an excellent report and I found it absolutely fascinating to read it. I'm very sad, really. Thank you.
Thank you, and thank you for the report. It really is a brilliant report. And again, it talks about the integrated communities, how we can make things better, using hubs, using pharmacies, and how we can look at that. And there is absolutely no doubt that GPs are working so hard despite really, really difficult situations, and the feedback is really positive in a lot of cases. I know there's an acknowledgement that people have really struggled with some aspects, and a lot of that seems to still be coming from COVID. Yeah. Can I just ask one question? This is the interim report, yeah? When's there going to be the full one?
We're calling this an interim report because although this is the full report of our survey findings, we want to do more work on this, and we've already started some conversations with colleagues in primary care, in general practice, about how we might work together to bring people and clinicians together to explore some of these matters, to think about what system improvement might look like. And what that would actually mean for people. And we've already held our first meeting with people with long-term conditions to start exploring about what do they think better would look like in terms of access, what might help them to feel like they're getting the right support to manage their long-term condition, to prevent that becoming something that potentially pushes them further into secondary care services or A&E, you know, if we're helping people maintain their well-being.
Yeah, absolutely. And it's so important to have co-production and lived experience within it as well, isn't it? Sarah, did you want to?
That's okay.
Yeah.
I wasn't sure if anyone was going to come in, but I just wanted to say two things really. What do I want to say? The current system isn't good for anybody. It certainly isn't good for GPs or wider members of staff, and it isn't good for patients. But the level of commitment that I see every day in our general practice workforce, and that, I mean, I was present, I think, for the conversation that you had with some of the primary care network clinical directors, Shan, for example, and it's summed up in a conversation I've got in front of me, which was that we really welcome this call to action, and I really like that phrase, call to action, for people and practices to work together to create the solutions. And I think, again, not to quote it too much, but I think it is a fantastic report in terms of the Darcy report, which I think will signal that shift in focus to building stronger primary and community care services. So that's really, really positive. But there's lots more I could say, but what I did want to leave it with, and this is reflected on, I think that it's called, I think it's page 66 in the full pack. But there's some quotes in here that concern me, particularly from GPs, and people must still come forward for care, because that was coming through, that people are presenting late, which is really worrying for GPs, but clearly very concerning for our residents. So it's just really to speak to the public really here. People must still come forward, and you are not putting a burden on the NHS. When you are seriously unwell, you must seek help, you must come forward, and that's what our services are there for. I think what probably I would say to our wider public is that because we have so in relative terms less funding, less GPs than we did, and huge increases in demand, and as I said earlier, 90% of all contacts are in general practice, so that demand curve that we talked about is felt significantly more in general practice compared to any other service. So triage has been a necessary innovation to be able to manage some of that demand, and yes, I know it's not universally light, and there are issues, and there is a commitment to improve that, but it is also there to ensure that those most in need do get the help, so please do still come forward.
Thank you, Sarah. Absolutely agree. People still need to come forward if they're worried or anxious about anything. Councillor Webb.
Yeah, thank you. I think I suppose, speaking as a 30-something-year-old bloke, probably one of those groups of people who are very unlikely to go to the GP at the best of times. And I actually do joke with friends that, you know, we're on that list. It's going to take us a while before we're seen in general, which is a shame. But we are also a group of people who are very likely to be quite happy with a digital triage form type thing, if it works. and if it is actually, I mean, I think that that's something to take away, that I imagine there are groups of the population who want to be able to go to the end of their street and walk into their doctors and say, I'd like to be seen today, please. There are large groups of our population that were probably very happy with an online form that they can fill in to start with, and then there's a triage process, and that's really quite a positive thing. But I think I would echo that there's a need for that to be as accurate and as comprehensive as it can be. And I think it's so important that if that works, you will get more people doing exactly what you said, Sarah, and going forward to GPs when they need it, not too late. My question, residents have come to us and spoke to us about that communication between where you've got maybe a specialist service, so you've gone to something for a particular issue, and that person, that nurse or whoever it is in that specialist service says, oh, you need a prescription for this, we'll send something through to your GP, and then there's a stop, and then the GP then says, oh, well, have I had that or have I not had that? They need to then get more confirmation from that original specialist, and there's a whole barrier there, and then there's, you know, days, maybe weeks are going by when you've gone to someone, you've spoken to someone, you've got the prescription, or you thought you'd got a prescription, but you haven't got a prescription. What are we doing around that? Anybody?
Can I quote the NHS Constitution? Secondary care, if they feel a drug needs to be issued, can you issue, and it is with urgency, can issue it immediately and to the patient. If they wish a GP to take over prescribing, a GP constitutionally has 28 days to receive the letter, read it, action it, and put it on the notes. So there is a little bit of managing patient expectations. So if you see a specialist, you can expect your GP within 28 days to have your prescription prepared and ready to take on. That's how it should work. However, unfortunately, that isn't in practice what necessarily is heard or put into practice. So that's how it should work.
Right.
Does that help?
No.
No. It's because it's not happening in practice. And I guess a lot of, sorry, I could talk for hours clearly about Sean's report, which I guess just to come onto it as a GP in the local system, I want to say York is a lovely place to work. We've got a fantastic general practice community, but it is a diminishing and a small one. And it is smaller than when I first started practicing. There are more specialists in the hospital. There are more beds in the hospital. There are less GPs out in the community. That if we want to make a difference, that has to shift. And that's where your spend goes wrong. You don't need more resources. You need the resources upstream. It costs £350 for an A&E attendance. It costs £27 for a GP attendance. It doesn't take rocket science to say that I can do a lot more in the community than one hospital attendant. So there is a fundamental problem. Demand is outstripping capacity, and that's been proven in every single area we've just talked about. When mental health services can't come, people come to primary care. When we can't get them seen, we keep seeing them. We don't have that additional capacity. We're a fixed number of people. So we're doing the best we can within the resource. I think what Sean's report desperately does is it shines a spotlight on where the problems lie. And we have to have an honest narrative with the public. And at the moment, waiting times are longer. You will not be seen in 2 weeks. And we will try our best to see you on the day, but we do not have enough capacity. And then, as Sarah knows, that's where this question of overflow capacity comes from. Who can best meet the needs? We are trying to work with community pharmacy. There are other resources, and we are signposting people more and more using digital tools to try and help them get them to the right place. But I guess we have to say it's a fixed resource. We're doing the best we can with it, but we're dealing with such huge more demand than we were pre-COVID. It's not gone away. Our secondary care colleagues, obviously, while someone is waiting well, they're coming to general practice. So we are having to find that additional capacity. We do need to think differently. And I know a lot of what we've heard today is about thinking differently. And I guess we do need to have a vision for a future for this, and I do hope we have one. And some of that is about looking at the estates, the infrastructure, and that future commitment to change. But we very much on this. General practice in York want to work with you because we want the satisfaction of the job. As a GP, I love seeing people I know. That's why I went into it. We offer cradle to grave care, and actually relationship is as satisfying for the GP as it is for the patient. So we want that. We want the same goal. But when I've got the doors and 4,000 people sitting there knowing they need needs, it's satisfying for both. So we want to do better. We have to try and focus the resource on where we can make the most impact. And I think that's the work we need to do with Healthwatch. And hopefully, and then the honest narrative about it is, we are not going to hit those targets at the moment with the resource we've got. So we do the best we can with it.
And I think an honest narrative is so important because we come across so much where people are accusing people or being unkind about people not doing what they're meant to do. And I think that is why an honest narrative is really, really important, because people are there because they love doing the jobs, they want to do it well, and they're working really, really hard. And the situation is tough, but I think we need to be really, really clear with people about what is happening. Yeah.
I think part of our purpose in putting this report together was to start acting as almost like an honest broker, because we can see there's anger, frustration on both sides. And actually, one of the things that I found most interesting was when we held a meeting where we were talking about access to GPs, one of the people in the room came in very, very angry indeed. But when we explained that actually more people are being seen than before the pandemic, some of those are now being seen online, but actually face-to-face appointments are nearly at pre-COVID levels, and there's more online and there's more telephone. There was something about the anger almost sort of just dissipating, and they wanted to then get involved in, well, how do we make this better for everyone? And that's where we need to get to. I know it's really hard. We've seen GPs in our sort of local press talking about the pressures they're under and the comments that come through. We actually need to have a really good conversation about how do we make this as good as it can be for our population, with the fact that we simply cannot meet the demand. How do we prioritise in a way that people respect, understand, will go with? How do we increase capacity? How do we use other bits of the system more effectively to make sure that GP support is there for the people who need it? How do we improve the communication between primary and secondary care so that we don't have GPs, members of the public, and people working in hospitals chasing each other for things, when actually, if you just get it done and get people told about it, it's off the list of things that need to be done. So I'm sure there are many, many things we can do, and we are committed to doing them. It's the next stage is continuing that conversation and bringing people with us on what the future of health and care provision in York looks like.
Absolutely. Thank you, Sharon. Did anybody else want to speak? Okay.
Sorry.
Oh, sorry.
Am I on? From a police perspective, obviously we're similar. We've opened up a whole host of different channels, but we haven't got any extra staff, and this is what the public, that realistic expectation, I think, is really key, is that we've tried to make it as easy and as accessible for everybody to get the service, but it hasn't changed the demand, it's increased the demand. So I think that's really key in any messages that we get out, is that we're trying to facilitate everybody being able to get access to the service. And some of that is in that triage. So we have a single online home reporting. It says at every opportunity, if this is urgent, if it's happening now, do not fill the form. How many people fill the form out? And then we don't see those sometimes for 24 hours. And there's somebody sat there and you're like, oh my God, So there's an education piece as well, I think, which you will all feel in every aspect of your worlds, that we need to just keep with that communication and that education for people.
And that's such a theme, isn't it, that's come out of today, communicating and honest messages to people. Okay. So if there's nobody else would like to make a contribution, okay, then that is the end. Thank you.